So, welcome again. Today we'll be covering the development of the teeth. In our last session, we did the development of the tongue and also the development of the endocrine glands of the head and neck. So, at this point in time, we are going to discuss the development of the teeth. It's going to be a very short presentation, and so welcome. So, given the fact that we are studying anatomy, we need to describe, first of all, the gross anatomical bit of the teeth. So we can appreciate that it has three parts: the crown, the neck, and the roots. So the crown now has the enamel, and then the dentin is the inside part. Pulp cavity contains the neurovascular structures. So talk about the blood vessels, the nerves, and then we'll have some few ligaments. These ligaments will be attaching now these gingiva, the gums, to the tooth. And then, of course, now we'll have the periodontum, you can appreciate here, and then the cementum now attaching the teeth to the bone. Anything else? Just to appreciate that we now have the various alveolar nerves supplying these teeth using the various smaller free nerve endings that will be present in the pulp cavity. Yeah, so that is it. Of course, now you'll have the neurovascular structures passing through to the pulp cavity via the root canal that is present in the various teeth. Histologically, this is what you can be able to appreciate. Can be able to appreciate that we'll have a dental pulp or the pulp cavity inside it. So this dental pulp will be containing the various cells, and then it will contain cells that provides nutrition to the teeth at this point. So it's actually a living tissue that is present there. Then you'll have a dentin. So this is a dentin. And then after it, now we'll have the enamel. And then you can remember the enamel is a part that is actually what you usually see. So for example, this enamel, histologically in a cross section is what you can be able to appreciate. Then you can appreciate, you will have three types of epithelium, or maybe two, and then maybe a middle one. So you'll have an outer one, an external enamel epithelium, and then we'll have now an enamel pulp, and then I will have an intermediate part. So intermediate or stratum intermedium, then I will have an inner part. That is the internal enamel epithelium. So how then do you form the teeth? So the teeth are formed in an interesting way because you'll undergo some various stages from thickening of the oral epithelium to its invaginating. Then you'll have now the scarp stage, the bell stage, and then the teeth will erupt. So you'll have an interaction between, it's usually called epithelial mesenchymal interaction between oral epithelium and the mesenchyme from neurocrine cells. So the teeth, at this point, all of it comes from the mesenchyme, given the fact that the oral epithelium will come from mesenchyme, from neurocrine cells, and also the mesenchyme surrounding now the oral epithelium will also come from neurocrine cells. But the two definitive tissues of origin is oral epithelium and mesenchymal cells. So these are oral epithelium, and down it will have now the mesenchyme. What happens at this point is that you can appreciate you'll have a thickening, as you can see in the next, that the basal layer of the epithelium forms. So this is a basal layer of the epithelium. It will thicken. It will thicken, as you can see there. So this is a dental lamina. First of all, it's a dental lamina. The basal layer of the epithelium forms the dental lamina. Then the dental lamina undergoes thickening or a downgrowth to give us dental buds. And these dental buds will be about 10 in each jaw. That's the reason why they are around 20 in each in a person. Because the initial primary teeth that are formed, they are 10 in each jaw. And then, of course, now this will be due to ectodermal components of the teeth. So you can appreciate this oral epithelium was coming from ectoderm, and then it goes downwards to give us the dental buds. So actually, what will happen now in our next slide, as you'll appreciate, is that this part of the of our bud, this part of our bud, it will undergo deeper elongation, and especially now on the ends. So we can appreciate the ends. These are the ends. These are the ends of the dental bud. They will undergo indentation. First of all, it invaginates more. So we started with thickening. So the thickening gave us a dental lamina. Then we had now this thickening giving us a dental bud. Then the dental bud undergoes further invagination. Invagination means we have this part going up. So this part going up is an invagination. This part going up, and then the outer peripheral parts having indentations. So when you have indentations, will be in the bell stage, but when you have invaginations, we form a dental cup. So we started with dental lamina, bud, then you go to cup, then you go to the bell. And the stages are, we had thickening, we had further deepening. Then after that, we had invagination on the cup. Then we had indentation, deepening and the indentation at this point in the bell stage. Then, of course, now we'll tell the last thing that will happen is due to continued proliferation of the mesenchyme, this indentation, this invagination will be forced out to give us a definitive teeth. So actually, these are the stages. You have the thickening, then you'll have a bar, then you have a cup, then you have the bell stage, and then erupted tooth. But before then, maybe an inner dental epithelial cells. So here, these are inner dental epithelium cells will form the ameloblast. And then what will happen is that on this ameloblast, we have enamel prism deposition of the dentine. So remember, the inside part now will form the dentine. Around this part will form the dentine. So these cells, the inner epithelium of this bell stage will give us the ameloblast of the teeth, which will form now, will deposit dentine. Then the mesenchyme around the tooth. So you have the mesenchyme. So this is a mesenchyme that is surrounding the developing teeth. They will form the cementoblast, which will give us the cementum. Remember, this cementoblast produce cementum, and this cementum is the one that will enable now the attachment of the root of the teeth to this bone, to the jaws by cementoblast. So origin of ameloblast, inner dental epithelium, at this point coming from oral epithelium. Then the mesenchyme will give us the cementoblast, which produce cementum. Then, as we said also earlier, that the mesenchyme also will give us odontoblast, which will produce dentine. So one of the neurocrest cells, one of the neurocrest derivatives is odontoblast, which will produce dentine. So that is also another point. So three cell types: ameloblast, which form the enamel prism, then mesenchyme around it, and then the cementoblast will also come from the mesenchyme surrounding the teeth, which will produce cementum. Then the mesenchyme now doesn't mean that just the mesenchyme that is surrounding the teeth. You'll have no mesenchyme that is just even outside, can just migrate. This mesenchyme cells will migrate and form the odontoblast, and this odontoblast will come and produce dentine. Then, of course, now with time, we'll have the eruption of the teeth. The eruption of the teeth will come from due to proliferation of this mesenchyme. So these odontoblast cells, cementoblast cells, ameloblast cells, they will continue to proliferate, and the teeth will not be pushed out due to proliferation of the mesenchymal cells and the developing bone that is just being formed at this form. But the most important thing that I can just emphasize is the thickening, bud, cup, bell, and the erupted tooth and how they develop, how they come across. So, maybe a question, identify the stage of tooth development in this image. So you can appreciate this teeth hasn't still erupted. It hasn't erupted. So this is not the bud stage. This is actually the cup stage. This is actually the cup stage. And the bell stage and advanced bell stage are not the answers there. So here the answer is the cup stage. Maybe a summary on the same is that we'll have the interaction mesenchymal epithelial. So this is a mesenchyme, and then this is the oral epithelium. So mesenchymal epithelial interactions or epithelial mesenchymal interactions. They are the ones that now will lead to formation of the teeth. So what happens is that you'll have the oral epithelium. First of all, undergoing thickening. Then it goes downwards to give us the oral, to give us this dental, to give us this bud stage, the dental bud. Then I want us to appreciate that when this dental bud goes downwards, like when it is elongating downwards, you'll have the cells of the mesenchyme, first of all, undergoing a transition there. So that means they will differentiate. They will differentiate. So the differentiation at this point is the one that now will come and give us a cementoblast that you'll see in a few minutes. And even the cells of the pulp cavity. And then in the cup stage, now what will happen is that we'll have invagination. The invagination now on the distal aspect of this part to give us now the cup stage. Invagination will happen there. Then in the bell stage, you can appreciate that now these cells that this of the mesenchyme, they have already gotten into this developing pulp cavity. This is developing pulp cavity, as you can see there. And actually they are being called pre-odontoblasts. And then of course now the secondary stage, given the fact that everything is formed, or what is just missing is just the eruption. And now you can see due to formation of the alveolar bone, we'll have now the bone, the teeth be erupting out. And then we'll have finally the developed tooth. So this process at this point it starts embryologically prenatally, then it finalizes maybe as a person grows each and every time. So with now the wisdom teeth coming at around the age of around the second decade. Yeah, but it's a process that comes continuously. Maybe on the same note now we can go to some few anomalies here. So the anomalies are quite simple because they are just anomalies in terms of number, in terms of size. So in terms of number, we'll have hyperdontia. Hyper means many, dontia means so extra teeth. Then hypo means like less. So complete absence. So endodontia means complete absence. Oligo means like partial absence. Then hypo means reduced absence. So anodontia, complete absence. Oligodontia, like that means the teeth is there. Some of them are there, but some of them are also there. So for example, you have incisors, canines, premolars, and molars. So in oligodontia, you'll find that this person has incisors and canines, where premolars and molars are missing in oligodontia. In hypodontia, that means you have all sets of teeth, but no, you're supposed to have like 4 incisors on the lower jaw, but you have 2 incisors. Similar case, you have maybe you're supposed to have like 2 premolars on the lower jaws, then you have 1 premolar. So hypo means like all the teeth are there, but no, they are reduced in numbers. Oligodontia maybe means 1 of those teeth are missing. One of those types of teeth is missing. Then in terms of anomalies in size, of course you'll have macro means large, so over development of the teeth. And then microdontia means smaller teeth, as seen in Down syndrome. In addition to that, no, we'll have anomalies in terms of shape, in terms of gemination, fusion, crocescence, and then we'll have dense invaginators. So in dense invaginators, we'll have an issue to do with during the invagination stage, the enamel folding wasn't that uh, normal. It was abnormal, giving you dense invaginators. Then you have fusion of the teeth by cementum of the root formation. Then you can have fusion of two teeth buds. And then, now of course, this fusion will give you like a macrodontia. Then gemination is where now this single tooth bud attempts to divide. So gemination is the opposite of fusion. So fusion, they come together. Gemination, they try to divide. Of course, now both of them will give you macrodontia. And then in terms of the structure, we'll have amelogenesis imperfecta. That means there is an issue to the development of the ameloblast. So gene defect affecting enamel formation, which will lead to a weakened and discolored enamel. Then in dentinogenesis imperfecta, it will tell you there is an issue to do with development of the dentin. So defective dentin development causing now an opalescent teeth prone to fractures, so a weak teeth. So imperfecta means, so in both amelogenesis imperfecta and dentinogenesis imperfecta, both teeth, both anomalies will have weakened teeth. So if you see anything to be imperfecta, there is weakness coming in. So it can be due to structural development or gene defect. And then the last one is an enamel hypoplasia, which comes across due to deficient enamel formation due to environmental factors such as malnutrition or infection. So I guess with that, that forms the end of the discussion today. So I'm looking forward to seeing you in the next video, most likely on the development of the respiratory system. So we're almost done with the next series. So see you in our next video on the developments of the respiratory system.